Before Health Information Exchange, we were very reliant on the parents, and parents would often sort of question us and say, why don't you know these things? The GP's got all the records, why don't you know? And we would just have to explain, unfortunately we don't have access to the GP records, and often parents would look at you as if you were crazy because they just assumed that the healthcare system were talking to each other.
So the HIE for the clinician in the ED reduces a lot of anxiety, it reduces a lot of frustration, and it can help your patient consultation go a lot more smoothly. The critical decisions that we make around the kind of medications, what the possible diagnoses are informed by getting good information from the patient's general practitioner. And the HIE allows us to do that in a matter of minutes.
Big benefits of HIE for nurses is bloods. So from a patient perspective, you know, you may not have to bleed your patient again, which is not a nice experience because you've got the information in front of you. Diagnosis, weights, all of that basic information that you need to get your care right, and good quality care is in front of you now. You don't have to duplicate tasks.
I am safeguarding children in a lot more timely manner, so the assessments are completed more quickly. Antenatal ladies are getting their appointments justifiably and not in error, so there's less upset and stress. We're not waiting around for other agencies to give us that information. We can get information ourselves within seconds.
I feel more comfortable in my role of giving back the feedback on the assessment and diagnosis if I've got a more complete picture of a person's past medical history and their current physical state.
So if I'm able to save time during the day when I'm doing my repeat medication requests, when I'm looking through my letters, then that allows me to go home on time, which is really important for my mental health. Because if I'm not picking up my daughter, and I think that's a really important thing, especially in primary care, that we need to be protecting ourselves a lot of the time. So I think that's where a lot of the efficiencies go to actually. We can build it into meaning that we can see more patients, but ultimately if we can protect ourselves, we're around for a lot longer to be able to see more patients in the long run.
It makes us feel reassured because we know that we're looking at the correct information in real time, and we're not relying on potentially incorrect details of medication or incorrect doses, and it gives us assurance that we're prescribing effectively and correctly.
I couldn't imagine working without HIE now, because when I think of the vulnerable patients who turn up in the A&E department, whether they're accompanied or unaccompanied, it gives us a wealth of information in order to process our assessments and to signpost the patients to the correct pathway so that they get the correct care at the right time.
I think to me, it means that I'm more efficient with my time. I can provide a faster service to the patient, and then I get happier patients, and then that makes me a lot happier as well.
The Health Information Exchange has been transformative with the information gathering process. So now we don't have to keep sort of hounding the GPs for further information.
And I think for any of my colleagues who aren't sure what they think of HIE, I think it's fantastic. I think it's possibly the best thing that's happened for us in recent history. That sounds a bit dramatic. I didn't mean it to sound that dramatic, but I do. I think it's the best thing ever.